So you're thinking about bariatric surgery. It's a massive decision, and it's absolutely packed with questions, concerns, and, of course, a lot of hope. This isn't just about one day in an operating room. It's about a whole new way of life. Today, we're going to walk through that entire journey together, step by step, so you can get a really clear, honest look at what it's all about.
Here's how we're going to break it down, basically following the path you'd take yourself. We'll kick things off with the big questions, the risks and decisions. Then, we'll get into what it takes to prepare for surgery. We'll demystify the procedure itself, and then talk about what your new reality will look and feel like. And we'll wrap up with what is maybe the most crucial part, the lifelong commitment that comes after.
All right, let's start right where everyone else does, with those big questions and the very real worries about risk that are probably on your mind. We have to face these head on, because this is the foundation for everything else.
And this right here, this is the fundamental question, isn't it? It is completely normal to hesitate before any surgery. So let's get into it. An informed choice starts with truly understanding the real risks involved. We're going to break them down.
Like any major procedure, there are things to be aware of. There's something called dumping syndrome, which is basically your body's new, very direct way of telling you it doesn't like sugary or fatty foods. Gallstones are pretty common, happening in up to half of patients, mainly because of the rapid weight loss. Now, more serious things like leaks or blood clots, they are much, much rarer, but knowing they're a possibility is just part of being fully prepared. So, let's get right to the elephant in the room. What is the actual mortality risk? Well, for a sleeve gastrectomy, the data shows a 30-day mortality rate of just 0.08%. To put that in perspective, that's just 8 patients out of every 10,000. But what does a number like that even mean in the real world? Well, it means the risk is statistically on par with some of the most common surgeries out there, like getting your gallbladder removed or having a hip replacement. All of a sudden, that scary-sounding statistic feels a lot more understandable, doesn't it? It really helps put the risk in perspective. Okay, so once you've weighed the risks and made the decision, the whole focus shifts to getting ready. This phase is all about preparing your body and your mind for this huge change that's coming. And here's the good news. You are not doing this alone, not even close. A whole team of specialists, we're talking heart, lung, psychiatric, and endocrine experts, will evaluate you. Think of it less like a test you have to pass and more like a comprehensive safety check to make sure you're set up for the absolute best outcome. Now for some practical tips that can make a huge difference. Packing a hospital bag is one of those small things that helps you feel in control. Comfort is key. Since you can't drink water right away, your mouth and lips get incredibly dry, so chapstick is an absolute must-have. You won't want to do a lot of bending, so loose, comfy clothes are your best friend. And honestly, never, ever underestimate the power of your own pillow from home. All right, let's pull back the curtain on the surgery itself. We're going to look at the 2 most common types because really understanding how they're different is so important for the choice you'll make. So here they are, side by side. With the gastric sleeve, a large part of the stomach is actually removed for good. This does 2 things. It makes your stomach smaller, obviously, but it also gets rid of most of the part that produces ghrelin, the main hunger hormone. Now, with the gastric bypass, they create a tiny pouch at the top of your stomach and then reroute your intestine to connect to it. Your original stomach stays, but food just bypasses it. So it really comes down to a choice between removal or rerouting. The surgery's done. You're in recovery. Now, the rest of your life begins. Let's talk about what you can realistically expect as you step into this brand new reality. One of the first things everybody wants to know is, when can I get back to my life? Well, if you have a desk job, you could be back at it in as little as 1 or 2 weeks. But if your job is more physical, you're going to need more time to heal. Think closer to 6 weeks. And the results? What can you actually expect to see on the scale? Well, the most dramatic drop usually happens in that very first month. After that, you'll likely settle into a steady rhythm of losing about 8 to 16 pounds a month for the first 6 months. It's a marathon, not a sprint, but seeing that initial progress can be a huge motivator. Let's talk about pain. Yes, you can expect some discomfort, especially around the incision sites, but here's the secret. Stay ahead of it. Don't wait until the pain is unbearable. If you take your medication on schedule before it gets bad, you can keep things totally manageable. And that makes it easier to get up and move around, which is so important for a good recovery. And that brings us to our last section, which honestly might be the most important part of this whole conversation. The surgery is an amazing, powerful tool, but that's all it is, a tool. Real long-term success is defined by what you do every single day from here on out. This quote really says it all, doesn't it? This is not a temporary fix. It's not a diet you're on for a little while. Your body's ability to absorb nutrients has been changed forever, and that means taking vitamins is now a non-negotiable part of your daily routine for life. So, what does that actually look like? Well, it means a specific daily regimen to make sure you don't develop serious nutritional issues. Things like iron, vitamin D, and folic acid are suddenly crucial. And just as important is protein. You have to aim for about 60 to 80 grams a day to make sure that the weight you're losing is fat, not your valuable muscle. And of course, there's exercise. But don't worry, no one's asking you to run a marathon right out of the gate. It starts super simple, walking on day 1. Seriously. From there, it's all about slow and steady progress. You'll walk a little more each day, then add in some low-impact cardio like swimming, and finally, when you get the okay from your surgeon, you'll start some lightweight training to build that muscle and really get your metabolism firing. One last, very critical lifestyle change we need to talk about is smoking. It is strongly discouraged. To heal properly and avoid complications, you have to quit at least 6 weeks before your surgery and stay smoke-free for weeks after. To be honest, a lot of people see this as the ultimate motivation to finally quit for good, and that really is the best way to go. So, there it is. We've walked through the risks, the prep work, the procedure itself, and the lifelong commitment it requires. This journey is so much more than just an operation. It's a complete shift in how you relate to food, to your body, and to your health. And so the last question is really the only one that matters. And it's one for you to think about. Are you ready to embrace this path?